I started off training in general practice after I finished medical school, and during that I saw lots of people with addictions, lots of alcohol problems. I'd also done an attachment to the accident and emergency unit, and of course we saw many patients who came in suffering from the effects of alcohol, and some people who were clearly addicted and needed to be treated with more long-term efforts. I went on to train in general psychiatry and then the psychiatry of learning disability, and we did an extra year of addiction training. If that was an option at the time, you could do that as part of your general training. And then I also did training in forensic psychiatry. It's usually very important to address the addiction first, because you can often find that, particularly most of my experience with working with people with alcohol problems anyway, was that they sometimes, in fact more often than not, if you managed to deal with the addiction and you got them abstinent, say after a month or so, a lot of their depressive symptoms would have changed. So you need to then think again about whether or not they need to be treated with medication, because it's really important to get that right. And some medications that are used for depression could make the addiction worse. Well, they suffer from just about any medical illness that you could think of. You know, they have liver disease, everybody thinks about that one, or brain disease, memory problems, permanent brain disease, nerve problems. They also have heart problems. Basically any system in the body is affected. So you would see a lot of coexisting physical illness, and of course often you'll see a lot of coexisting mental illness. A lot of people will have depression, or pretty much any psychiatric illness can go alongside addiction. So in my experience, it's really important to actually first of all address the addiction problem and support them and get them as stable as you can before you go back and look again at the mental health issue.